Good morning, everybody. My name is Dr. Zha. I am a physician at CBHA. I'm also the clinic lead liaison of the task force against COVID-19 here at CBHA.
I'm Dr. Jude Alsarraj. I'm a clinical team member, and I'm working with Dr. Zha on COVID-19 task force.
So we are here today to answer more of your questions, and we will try to do these videos once a week from now on. So maybe I'll get started. So my first question is, people who have underlying conditions such as high blood pressure and diabetes are frequently on medications such as ACE inhibitor like lisinopril. There are some people talking about whether these medications give you higher risk of developing severe disease of COVID-19. Can you shine some light onto that?
Yeah, so I want to first read a statement from the US heart groups where they said patients with COVID-19 should continue ACE inhibitors and ARBs that are medication that are used for heart failure and for hypertension. We really have to continue these medications. There's no evidence currently that any of these medications will either lead to COVID-19 or will give you a severity of the disease if you get COVID-19. There was an opinion letter that was published that it said that these medications may increase the ability of the virus to go into the lungs, but there is really no evidence, there is really no data. So please do not stop your medication unless you talk with your provider and consult with them.
Yes, and as a clinician, I like to mention to the patients who are listening, who are on these medications, that it's not a good idea at this point, especially during a global crisis like this, to stop your medications or change your medications on your own without a physician's direction. This is because we know for a fact that patients with cardiovascular conditions such as hypertension, heart failure, or history of heart attacks do suffer more of the severe complications of COVID-19, which makes it even more important for us to be able to control these conditions at a good place. So we really urge you to not change medications on your own. And the other thing is, if you do stop these medications on your own and you have rebound hypertension, sometimes we see patients who stop medications on their own and they develop hypertensive emergency conditions such as a heart attack or a stroke or even bleeding in the brain that would cause a lot more damage than the theorized potential of making it worse.
And probably when you're not taking your medications, your hypertension is not controlled, for example, and that will probably put you at higher risk of having severe illness just because you're having these uncontrolled underlying conditions.
Yes.
So yeah, I think we just have to make this statement to continue the medications.
Yes. So Dr. Alsarraj, I have been getting questions about this particular symptom from patients, and also I've been seeing that on social media. What about this loss of sense of smell or taste being part of the coronavirus symptoms?
Yes, that's a good question. So doctors from China, Italy, South Korea, and even here in the US, they have reported that some of their patients who tested positive for coronavirus did lose the sense of smell or taste. And you probably hear about it a lot in social media because there's a lot of celebrities or some celebrities who actually reported that they lost the taste and the smell when they got tested positive for coronavirus. And there was a review that was published on March 13 where they showed that the coronavirus may target the nerves in the nasal passage, and that may be the reason why there is a loss of either the smell or the taste in those patients with coronavirus. So do you have other data that you looked at from Wuhan or any other countries that mentioned the loss of the sense of smell?
There are limited data on this, but there was a study coming out of Wuhan, China, that looked at 214 patients. Only about 5% people experienced a loss of smell. And they did comparison between severe patients versus mild disease. They did not find that this symptom is a reliable symptom to distinguish between severe or mild cases. So just because you might have it doesn't mean that you are going to end up with a severe form of COVID-19.
Right.
I would also like to mention that there is a official statement made by the United Kingdom ENT physicians that came out on March 19th. They said that at present, many affected patients do not have other symptoms or only mild disease, and therefore do not meet the criteria for testing, which is also the case in the United States. While loss of smell may be caused by other viruses, we think that it is reasonable to assume that COVID-19 is the cause until tests prove negative. We therefore advise that patients follow current guidelines for self-isolation if they do develop symptoms like that.
Right, right. And I think the WHO, the World Health Organization, did say actually that they're investigating that loss of smell and probably the taste too. However, since it's a new disease, there's really not there's no data, about this disease, and so it's important for patients too who get sick to report every symptoms that they're seeing, because that will allow clinicians and everybody around the globe to look into the symptoms and see if it's something that everybody's going to experience, what's the probability of that. So please, if you get infected with COVID-19 and you're talking to your provider here at CBHA or anywhere else, try to report any symptoms that you're seeing so we can use it for other patients and for the population. So Dr. Zha, can we talk a little bit about testing for COVID-19? So how reliable is the test for COVID-19 when we get the results, negative and positive results? So can you tell us a little bit about that?
Yeah. So currently in the United States, the most common type of testing we're using is called PCR, which means that we take some of the genetic material of the virus and we amplify it in this machine, and that would make it more detectable for us to see the virus, which means that if you do have a positive result, it is pretty accurate that you have it. However, because of the amplification and how many days it takes for this genetic material to appear in your mucosa, if you have a negative result, it actually might be less accurate. So the sensitivity of this test is about 62 to 67% per the global data, which means that if you test negative, about 1/3 of the chance that you actually still have it, but we just did not detect the genetic material of the virus.
So, and I think for, in general, if you have any COVID-like symptoms and you get tested, but the test comes back negative, there's no need for you to go and repeat the test one more time. So what you can do is you can self-isolate. If you have any symptoms, just make sure that you wear a mask. If you're at home and you're interacting with other people from your household, social distancing as well. Now, however, if your symptoms become worse, just make sure that you call your provider and talk to them, and then they can lead you to what's next and if you need to get tested again or not. But usually if you test negative, you do not have to test it one more time unless there is any reason for that.
Yes. So Dr. Alsarraj, when people ask about hand washing, we tell them that you need to use soap and water and wash your hands for at least 20 seconds. What is the evidence for that?
Yeah, so the evidence for that is coronaviruses. They're viruses that have an outer layer. It's a lipid layer. And that outer layer cannot be broken by just water. So if you just wash your hands with water, that outer layer is not going to break. So you need the soap to break it. And that will basically break it into little pieces and it will inactivate the virus and kill it. So, and that's why we say 20 seconds, because you need to keep washing until all pieces of that layer are broken, and that will totally inactivate the virus and not kill. And will kill the virus, and hopefully you won't be infected. So that's why we say wash your hands with soap and water and for at least 20 seconds. So for the kids as well, just to, it's really boring. So just make sure that you explain for them that we need to break the outer layer of the coronavirus. And it's also important that you wash your hands, but don't touch your face, don't touch your eyes, don't touch your mouth after washing your hands. And if you do so, please go back and wash your hands for another 20 seconds with soap and water. So Dr. Zha, how about co-infection? So can patients who test positive for coronavirus, for example, also test positive for something else, such as influenza, RSV, or any other viruses that we see, here in the clinic and everywhere else? Yeah.
Yeah, so that's a good question. There is a big study coming out in China looking at 562 patients, over 500 patients. And what they found was that almost 1 in every 4 patients who had coronavirus also had another infection by another either virus or bacteria. I think this speaks to the importance of staying at home when you're sick, because you can have influenza and a lot of people think, oh, I have influenza, that's all I have and I cannot get another virus. That is simply not true. When you have another infection, your immune system is under attack already, which probably makes it more likely for you to be infected by another virus such as coronavirus. So if you are sick with anything, the most important thing is for you to stay at home, even if you don't have COVID-19. That way you can not only prevent other people from getting infected with what you have, but also preventing yourself from getting coronavirus on top of what you have already.
So, as the numbers in the United States rise really and climb up to the most, cases in the world, what lessons can we learn from other countries, or any other ideas you want to give us to fight this virus and the infection?
That's a very good question, an important question to ask. There have been countries that have really large predicted numbers of mortality and also caseload, but they did not actually end up getting there. And the one main reason was social distancing, and people took it very seriously. I think in our community, the most important thing right now is to really, really take that seriously and socially distant. This kind of concept helps me change my mindset as well. Instead of thinking about social distancing as a means for you to change your behavior to avoid being infected, think about it as if you are already a asymptomatic viral carrier, which means you already have the virus, but you don't have symptoms. You can still spread it to other people. So think of it as if you have it and change your behavior to stop the spread into the community. That really helps me.
Well, that's a very good lesson to learn, and we just have to assume that everybody is infected and just not transmit the virus. So thank you for your you watching us today, and we'll see you next time.